Hello friends, you are watching Physiology Made Easy. Friends, we will try to understand Hemopoietic system in detail through this video series. If you like the video, please hit the like button. Kindly subscribe the channel and also press the bell icon to receive all notifications regarding more such informational videos. This is second video in this series in which we will understand plasma proteins. The topics covered in this video are types of plasma proteins, site of formation of plasma proteins, their amount in blood, their properties and their functions, and lastly, causes of hypoproteinemia and hyperproteinemia. So let's start the topic. Types of plasma proteins. Plasma proteins constitute important organic component in plasma. They comprise of more than 300 types of proteins consisting of simple as well as conjugated proteins. They are classified into three main categories: albumin, which accounts for 60 to 70% of total plasma proteins; globulins, which account for 30 to 40% of total plasma proteins; and fibrinogen, which accounts for 4 to 5% of total plasma proteins. Remainder less than 1% of plasma proteins can be considered as regulatory proteins. They consist of enzymes, proenzymes as well as some hormones, and they help in many different processes such as immunity, blood clotting, etc. Globulins are further categorized into alpha 1, alpha 2, beta and gamma fractions depending upon their electrophoretic mobility. The most significant gamma globulins are immunoglobulins or antibodies. Let's see some of the different forms of these globulins. Some examples of alpha 1 globulins are alpha 1 antitrypsin. It is the enzyme that protects the liver from damage caused by inflammatory enzymes. Alpha 1 lipoprotein, that is HDL. It transports cholesterol from peripheral tissues to liver, which helps in its removal by secretion in bile. Next is orthomucoid. It is an acute phase protein. Its level is elevated in acute inflammatory conditions. Next are retinal binding protein, cortisol binding protein and thyroxine binding protein. As their name suggests, these globulins are essential for the transport of retinol, that is vitamin A, cortisol and thyroxine respectively. Alpha 2 globulins examples are alpha 2 macroglobulin. It works as reserve proteinase inhibitor and also inhibits plasmin. Haptoglobin. It combines with free hemoglobin and prevents iron loss and renal damage. Prothrombin. As you all know, it takes part in blood clotting process. Ceruloplasmin. It is essential for the transport of copper. Next are beta globulins. Examples are beta lipoprotein, that is LDL. It transports cholesterol from liver to peripheral tissues, and because of its atherogenic potential, it is termed as bad cholesterol. Transferrin. It is important for transport of iron. Hemopexin. It is essential for transport of free heme to liver. Plasminogen. It is important for fibrinolysis and restoration of normal blood flow. C-reactive protein. It is also an acute phase protein and its level rises in response to inflammation. Next are gamma globulins. Clinically significant of them are immunoglobulins, which are of 5 types: IgG, IgA, IgM, IgD and IgE. They are also known as antibodies. These immunoglobulins will be covered in separate video later. Next is site for formation of plasma proteins. In embryo, plasma proteins are formed by mesenchymal cells, whereas in adults, all the plasma proteins except gamma globulins are formed primarily in the liver, alpha and beta globulins are also formed by the spleen and bone marrow. Gamma globulins or immunoglobulins are formed by plasma cells. These cells are derived from B lymphocytes. Next are their amounts in blood. Plasma proteins, their total amount is 6 to 8 grams per 100 ml of blood. Albumin 3.5 to 5.3 grams per 100 ml of blood. Globulins 2.5 to 3.5 grams per 100 ml. Fibrinogen 0.2 to 0.4 grams per 100 ml. And other regulatory proteins, they form less than 1% of total plasma proteins. Next is albumin to globulin ratio. It is 1.7:1. This ratio is of clinical importance. It gets decreased or reversed in liver diseases. Next are the properties of plasma proteins. First one is molecular weight. Molecular weight of albumin is 69,000. Molecular weight of globulins, it ranges from 90,000 to 1,56,000, and that of fibrinogen is 5 lakhs. Next is osmotic pressure. It is about 25 mm of Hg. Next is specific gravity of plasma proteins. It is about 1.026. Next, properties: solubility in water and salt solutions. So, albumin is soluble in distilled water, whereas globulins and fibrinogen, they are insoluble in distilled water, but they are soluble in dilute salt solutions. Next is their amphoteric nature. Amphoteric compound is a compound which can act as both as an acid as well as a base. It is possible because of the presence of NH2, that is amine group, and COOH, that is carboxyl group. Next is electrophoretic mobility. Phoresis means migration or movement, and electrophoresis means movement of substances under the influence of electrical charge. In electrophoresis, charged particles move towards the oppositely charged electrode. Fractions of plasma proteins move under the influence of electrical charges and are divided into albumin, alpha 1, alpha 2, beta and gamma globulins. Next is precipitation by the salts. Plasma proteins can be precipitated by using different concentrations of salts. Ammonium sulfate solution is utilized for this process. Other than these, some plasma proteins possess specific properties. For example, albumin has the property of heat coagulability. Fibrinogen has the property of clotting, in which it is converted to fibrin. Let's now understand the functions of plasma proteins. Firstly, they exert osmotic pressure, which is about 25 mm of Hg, and albumin alone is responsible for 70 to 80% of the osmotic pressure. Let's understand this function in detail. In this picture, a blood vessel is shown supplying a tissue. For our convenience, no blood cells are shown in the vessel. The white circles represent the proteins present in the plasma, especially albumin, and blue dots, they represent the water molecules. Let's see the role of albumin in blood. Albumin exerts osmotic pressure in the blood. Because of this pressure, it carries out two kinds of functions. Firstly, it holds water molecules inside the blood vessel and does not allow them to leak out of the vessel. And secondly, it draws the water molecules present in the tissue spaces inside the blood vessel. This prevents excessive leak of fluid from the blood into tissue spaces, and thus it prevents edema and also regulates blood volume. Next is the maintenance of viscosity of blood. Fibrinogen and globulins are major contributors of viscosity of blood due to their asymmetrical shape. Next is clotting of blood. Fibrinogen, prothrombin and other clotting factors play an important part in it. Next function is buffering action. Now buffer is a solution that prevents significant changes in pH of body fluids, especially blood. Because of their amphoteric nature, plasma proteins can act as buffers. They contribute for about 15% of the buffering capacity of blood. Next, they can act as reserve proteins. In conditions like starvation, deficient protein intake through diet, or their excessive catabolism, plasma proteins are utilized by body tissues. Next is formation of triphones. Plasma proteins are utilized by leukocytes for formation of triphones, which are necessary for nourishment of tissue cells. Next is suspension stability of RBCs. This is the property of the red blood cells because of which they remain uniformly suspended in plasma. The negative charge on the RBCs keep them dispersed in the plasma. Albumin helps in maintaining negative charge on RBCs, hence it increases the suspension stability of the RBCs. Fibrinogen and globulins decrease the negative charge on RBCs and decrease the suspension stability of RBCs. Increased fibrinogen and globulins also increase the ESR. Next is their role in immunity. The gamma globulins are antibodies which play a role in humoral immunity and protect the body from pathogens. Next is their fibrinolytic function. Plasminogen plays an important role. Fibrinolysis involves dissolution of the stable fibrin clot within the blood vessel. So it preserves the patency of the blood vessels and also restores normal blood flow through the blood vessel. Next is transport function. Some of the important carrier proteins and the substances carried by them are shown in this table. Let's see them one by one. First one is albumin. It transports hormones, amino acids, drugs, fatty acids, calcium and bilirubin. Next is thyroxine binding protein. It transports thyroxine. It is also known as thyroxine binding globulin. Next is cortisol binding protein. It transports cortisol. Plasma proteins also carry carbon dioxide. Some amount of carbon dioxide combines with plasma proteins to form carbamino compounds, and in this form it is transported through blood. Next is transferrin. It transports iron. Ceruloplasmin. It transports copper. HDL and LDL, they transport fat-soluble vitamins, that is vitamin A, D and E. Next is transcobalamin. It transports vitamin B12. Haptoglobin. It transports free hemoglobin through the blood. Hemopexin transports heme, that is free heme. And lastly, retinol binding protein. It transports retinol or vitamin A. So in summary, transport of various substances through blood is mainly carried out by albumin and alpha and beta globulins. All these functions can be easily remembered with the help of a mnemonic. Click the I button if you wish to see the video of mnemonic regarding functions of plasma proteins. Next we will consider hypoproteinemia. Hypoproteinemia means lower than normal levels of proteins in the blood. Let's see various causes of hypoproteinemia. First one is nutritional, that is dietary deficiency of proteins. Next is malabsorption, which is seen in various intestinal disorders which are associated with hypoproteinemia. Liver diseases like hepatitis, cirrhosis of liver, in which synthesis of proteins by liver is reduced. Next is kidney diseases like nephrotic syndrome, in which proteins are lost in the urine, so it leads to hypoproteinemia. Next is hemorrhage. Hypoproteinemia occurs when plasma volume is restored after an acute severe hemorrhage. It is also associated with chronic blood loss. Next are extensive burns. The burn wounds produce protein loss through exudation and an acute inflammatory phase in which protein synthesis in liver also gets affected, so it leads to hypoproteinemia. Next are hereditary disorders like hereditary analbuminemia, in which there is no or low serum albumin, and congenital afibrinogenemia, in which blood does not clot normally due to lack of fibrinogen. Now we will consider hyperproteinemia. It means higher than normal levels of proteins in the blood. The causes are hemoconcentration due to dehydration. In conditions like diarrhea, vomiting, diabetic acidosis, this kind of hyperproteinemia can be seen. Next, acute inflammatory conditions. In acute inflammatory conditions, there is increased synthesis of acute phase proteins such as alpha-1 antitrypsin, C-reactive protein, fibrinogen, haptoglobin, etc., which causes hyperproteinemia. Chronic inflammation and malignancies. C-reactive protein levels are increased in such conditions. So this is all about plasma proteins. I hope you find this video helpful. Next video in this series will be regarding the red blood cells. Thank you.